Hello everyone out there. My name is Mercy Emmanuel Wogo and I am a certified autism specialist and the CEO of Autism Care and Therapy Services. Autism Care and Therapy Services is an organization that provides different forms of therapy services for the special needs children and care services for the elderly. I'm going to be giving you tips on the different domains of therapy, and in my videos, as you watch one after the other, you are going to be enlightened on how to care or cater for your child who has special need or different kinds of special needs. Let's look at sensory processing disorder. Sensory processing disorder. What is sensory processing disorder? Is the inability of the nervous system to process the information it receives from the senses, and this usually results to motor or behavioral responses, and these responses can be very socially inappropriate. They can be very socially inappropriate. That's when you see a child who is screaming on the road, you see a child who doesn't want to eat some kind of food, you see a child who is crying, throwing tantrums. Something inside is making the child to behave like that. So the sensory processing disorder, the child can be hypersensitivity or hyposensitivity. When the child is hypersensitivity, it means that the child is receiving too much information from his or her senses. And when the child is hyposensitivity, means that the child is receiving little information from the senses. And how do you handle that? There are behaviors associated with hypersensitivity and hypersensitivity. And with time in my videos, I'm going to be unfolding this information to you and the way out. We have talked about sensory processing disorder, what it is, and the thing is, child can be hypo or hyper. In my next video, I'm going to be taking one of the senses. I will tell you the behaviors associated with it and the way out. So be ready to watch my next video. Thank you so much.